Hello everyone, my name is Jaylene Ramirez and I'm a PA student at Drexel University. Today we'll be discussing professional interpretation services and its underutilization in the emergency department, as well as how the use and non-use of interpretation services impacts patients every day. But before we get started, I just want to give a brief disclaimer that I have no financial interests or relationships to disclose. The overall goal of my graduate project and this presentation is to bring awareness to providers, especially to those working in the emergency department, how we need to increase our use of professional interpretation services. Thus, the presentation today will consist of an introduction, list of objectives, a discussion regarding the barriers studies are attributing to the underutilization of these interpretation services, as well as the importance of interpreters. We will then go over some clinical scenarios to bring everything together, and then finally discuss possible solutions that you could implement in your medical practice or work environment. Various studies have been conducted along the years that consistently demonstrate that professional interpretation services are not used as often as they should be. When it has been shown time and time again that the use of interpretation services leads to greater patient outcomes. Now the question is, why don't we use them more often? Professional interpretation services come in a multitude of modalities. You have the traditional format where an in-person interpreter can be in the patient encounter with you. You also have services over the phone and through a tablet similar to FaceTime, which can provide quick and effective interpreter services for our patients. With each passing year, the U.S. population has an increasing number of limited English-speaking residents. In 2018, it was reported that 67.3 million U.S. residents spoke a language other than English at home, further reinforcing the importance of these services. In my experience in the emergency department, I witnessed many patients come in who did not speak English, or if they did, they spoke it very poorly. And these patients are considered LEP patients. LEP meaning limited English proficiency. And sadly, more times than not, these patients were not provided a professional interpreter, although these services were available and easily accessible. Now I want you to think for a second. How would you feel if you were in a foreign country having to communicate with a medical provider in a time of need in a language you did not speak or understand? You see, this makes things pretty complicated. And this is why professional interpretation services are so important. It has been shown that not utilizing a professional interpreter can lead to higher costs of care for the patient, poor adherence when it comes to medical treatments, follow-up care, and return precautions. Patients are also subject to unnecessary testing, and overall a higher likelihood of medical errors occurring to them. And this all makes sense. If a patient cannot effectively communicate for themselves, how are we going to reach a diagnosis? We ask many questions and need their answers, as it helps us rule in or rule out medical conditions. Without those answers, of course there will be unnecessary testing and higher costs. By the end of this presentation, you'll be able to identify when to utilize professional interpretation services while attending to patients, be able to recall the barriers that are affecting the use of professional interpretation, and be able to educate colleagues about the importance of utilizing these services. Now, there are two barriers that impede the use of professional interpreters, and one is the fact that the decision to use or not use a professional interpreter lies with the provider. In other words, there is no standard practice or procedure in regards to the utilization of professional interpretation services. Then there's a second barrier, and this is the reliance on ad hoc interpreters. Now, going back to the first barrier I mentioned, provider decision making. Why are providers not using professional interpretation services? Well, there seems to be a couple of reasons why they don't. Factors such as available time, notice, level of acuity, time of visit, even the type of conversation that the provider may be having with the patient can affect whether or not they decide to use a professional interpreter. Take, for instance, a 2019 retrospective study by Hartford et al. They evaluated 36,992 patient encounters that occurred in a Seattle pediatric emergency department. And out of these patient encounters, 5,670 of them were considered LEP patients. And they reported that 45.4% of these LEP patients were not provided a professional interpreter. In addition, this study reported that if a patient was assigned a higher acuity at triage, specifically having a triage level 3 or lower, and or visit at a time of low volume, which the study considered a visit before 2 p.m. and after 2 a.m., these patients had a higher likelihood to receive professional interpretation. I don't know about you, but when I go to see a medical provider, I definitely want to make sure that effective communication between the two of us is not affected by the time I came in or by the acuity level assigned to me. To make matters worse, the kind of conversation between a medical provider and a patient also matters. A study by Lyon et al. Analyzed 50 recorded ED visits and 312 communication events that occurred within these visits, and found that a professional interpreter was more likely to be used during longer conversations, such as when getting a detailed history, in comparison to shorter conversations, like during procedures and during the administrative medications. They noted that time and anticipation of shorter conversations and updates were reasons for decreased use of interpretation. This study showed that there was inconsistent use of professional interpretation, just favoring and emphasizing the fact that underutilization of these services exist. There was also another study in 1996. It was a cross-sectional study by Baker et al. And they found that providers did not use an interpreter, a professional interpreter, for 101 out of 222 LEP patients, even though they reported that it was necessary. That's 46%. The study also found that when a provider self-reported that they had poor Spanish abilities, and the patient self-reported that they had poor English abilities, an interpreter was actually only used 34% of the time. This only emphasizes that there continues to be a lack of interpreter usage, even back to 1996, and how the use of an interpreter is determined by the provider and not by the patient's needs. Next, I want to talk about the second barrier that is affecting the utilization of professional interpretation services, and that is the reliance providers have on ad hoc interpreters. An ad hoc interpreter is nothing more than someone who is not trained professionally to be an interpreter, but is called in to interpret. These interpreters include family members, the patient's children, or even fellow staff members that happen to know the patient's preferred language. But keep in mind, the ability of an ad hoc interpreter to provide accurate and reliable interpretation can vary greatly because they have no training. They may consider themselves fluent speakers of a certain language, but in reality may only know how to speak it at a basic level, and that would not be sufficient enough to provide proper interpretation about detailed medical-related explanations in regards to explaining about diagnoses, patient education, and discharge information, which we know plays a vital role in patient care. A few reasons ad hoc interpreters seem to be favored are related to time, technical difficulties, lack of knowledge about the risks of using these type of interpreters, the laws related to interpreter use, in addition to possible lack of training in knowing how to use a medical interpreter properly. I can understand why providers rely on ad hoc interpreters. There's no technical difficulties with people or any need to understand any sort of software that a professional interpretation service requires, like with a phone or a tablet. An ad hoc interpreter may even require less time, it seems like, because all you really need is to find a person that knows the patient's language. And many times that person is in the room with the patient, like a family member. In 2016, Mayo R. et al. Conducted a survey with 150 medical providers in a South Carolina health system. They concluded that effective communication was a priority amongst those who participated. However, wait times and technical difficulties with certain modalities, like using the phone or the tablet, were reasons they quote-unquote cut corners and would use an ad hoc interpreter instead. In another study in 2020, Tierra B.R. et al. Conducted an anonymous survey with 259 ED employees. Out of these employees, 67% of them were unsure if their hospital had any policies regarding professional interpretation use, and 65% of them reported having used an untrained interpreter, or also known as an ad hoc interpreter, with an LAP patient before. The majority also reported that they had received limited training in how to use a professional interpretation service at their place of work, with only 19% claiming they had received formal training. To make matters worse, there's a law. It's called Title VI and Executive Order 13166, which states that facilities and institutions that receive federal assistance are required to have access and provide professional interpretation and other services for LEP individuals, and this includes public hospitals. So in other words, professional interpretation services are already in place in many settings, but medical providers are choosing not to utilize them due to the reasons I already told you. It is important to note that these studies do have a survey design in common, which does allow for self-reporting bias to be a limitation to their data, but they all did come to the same conclusion. Ad hoc interpreter reliance remains to be a barrier, even though professional interpretation services were available in the EDs these studies were conducted in. Having mentioned the reliance on ad hoc interpreters, it is important to mention why we should not rely on these type of interpreters. Don't get me wrong, some interpretation is better than no interpretation, but ad hoc interpreters has its risks. An ad hoc interpreter are not professionally trained. This leads to errors in interpretation, potential violations of confidentiality, as these interpreters likely do not know about HIPAA laws or even have to uphold them, as many times it could be the patient's own family that's interpreting. In addition, there is no guarantee that all the information being said by the medical provider is actually being communicated to the patient correctly. And in the cases where the ad hoc interpreter is a family member, now we're involving an emotional component that can affect the accuracy of the interpretation and the whole conversation. Family and friends are likely to include their opinions. This is why a professional interpreter is superior, as they solely provide a bridge to allow for effective communication between the patient and the provider. They do not add anything to the conversation, nor provide their opinion. Now, with all the information I have provided you, I want to go over 2 clinical scenarios that will help tie this information all in. Here's the first one. A PA is in charge of the care of a Spanish-speaking 35-year-old female in the emergency department who just diagnosed her with a UTI with the help of a video interpreter. The PA decides to prescribe her ciprofloxacin 250 milligrams twice a day for the next 3 days. The PA believes they no longer need an interpreter and hands the prescription to the patient and tells the patient, "This is your medicine." The patient was not provided any education about how to take this medication, so the moment she felt her symptoms resolved, after the first day, she stopped taking the antibiotic. The patient then presented a few weeks later with a UTI. Now, I want you to take a few seconds to think about this scenario. Could we have changed this patient's outcome? Well, I believe we could have. If the PA would have continued to use a professional interpreter like they did before, and properly educated the patient about the medication and the importance of finishing the antibiotic course with the help of the interpreter, the patient would have likely had their UTI resolved and may not have come back and be at risk for further complications like pyelonephritis. And again, the lack of interpreter use is not only affecting their medical care and their health, it's also affecting their finances. They had to return and be subject to additional co-payments, had to maybe take time off work, which means money lost, and possible other costs associated with the visit. Now, here's the second scenario. A Portuguese-speaking 45-year-old male patient presented to the ED with right lower quadrant pain for the past 2 days. The physician decides not to use an interpreter as the patient knows some English. As the physician asks questions and the patient tries to respond to the best of their abilities, but is unable to fully explain their symptoms and history due to their limited English vocabulary. The physician decides they want to get a CT with contrast to rule out acute abdomen etiology and asks the patient, "Do you have an allergy to contrast?" The patient hears this and thinks, oh, he just said contrast, which in Portuguese means contraste, meaning difference. The patient hears this and thinks the physician made a mistake and out of habit says no. After the study, the physician goes to check on the patient and notices the patient is scratching their skin intensely and is experiencing shortness of breath. The patient's having an allergic reaction. Now again, I want you to take a second to think about this scenario. Could this have been avoided? Well, again, I believe it could have. The provider should have noticed that the patient's English was not proficient enough to have a proper conversation and should have looked for a professional interpreter service to use during this encounter. By using the services, he could have possibly avoided this outcome, as the interpreter would have just taken a few seconds to interpret that question. Even taking note of the patient's nonverbal communication, the provider could have noticed that the patient was not fully understanding and realized an interpreter was necessary during this encounter. So, what are our solutions? Well, we have a few options. Thanks to the studies evaluating the underutilization of professional interpretation services, their observations can help us pinpoint what we must do. Professional interpretation services are available and have been for a while now. And as previously mentioned, they come in a multitude of modalities. There's in person, services can be done over the phone or through a tablet. What we must do is just use them more frequently, ideally with every LEP encounter we have. We need to have self-awareness while working with our patients to make sure effective communication is occurring, whether they're English proficient or not. Education is also key. We need to educate our fellow colleagues about the need to increase our professional interpretation use and make them aware about this issue. There was a study that I brought up earlier about how the majority of the participants reported that due to their limited training with professional interpretation services, they would rather lean on using an ad hoc interpreter. So I encourage you, if you do not know already, to see what professional interpretation services are available at your place of work and get comfortable. Find out where you can find them and how to utilize them. Try to get formal training or even informal training. Someone at your place of work must know how to use these services. And if no services are available, there's multiple phone applications that you can download. This at least assures you that what you're wanting to say to your patient is being said. I listed a few applications here. You have Google Translate, iTranslate, Medibabble Translator. Some are free, some may require subscription, but in the palm of your hand, you're able to translate any phrase or question you have for your patient in any language. And you can even provide this application to the patient so they could do the same with you. Some apps even have pre-made phrases commonly used in the medical field available in multiple languages. It is also understandable that obtaining a professional interpreter during an emergency, like during a trauma, is not realistic, which is why knowing your population is important. If you're working in a predominantly Spanish-speaking community, for example, learning some common medical terminology, like the body parts, common phrases, or even the common chief complaints, that can be useful in those moments. And lastly, I know I said ad hoc interpreters should not be relied on, but like the saying goes, something is better than nothing. Ad hoc interpreters should be considered last line when nothing I previously mentioned is available, or again, during emergent cases, when you don't have the time to involve a professional interpreter. To build off the idea that education is key in regards to increase our use of professional interpretation services, I wanted to mention something. I believe that when you're confident in using something, whether that be a suturing technique or explaining the mechanism of action of a certain medication, I find that we are more likely to do them, more likely to perform that technique, more likely to explain the pathophysiology of something. So with that being said, if you're feeling unsure or unconfident about how to use a medical interpreter, there are resources out there for you to become more educated in how to use them. So you gain that confidence in order to use them more often. For example, the American Academy of Family Physicians have a great article discussing how to appropriately use a medical interpreter. They created the tips that are right on this screen. They mention a few. They say that we should allow extra time for the interview. Seat the interpreter next to or slightly behind the patient. Also ask only one question at a time. They also mention to document the name of the interpreter in the progress note. And one of my favorites, using the teach back method to ensure patient comprehension. And that's just a few out of all these tips that you see right in front of you. And I do encourage you to pause the video here or to go to their article so you have a little more time reading this material. This is the end of my presentation. I do hope you found the information I presented and the clinical scenarios I provided you useful. I would greatly appreciate if you could take a moment of your time to complete the following evaluation, as your feedback would help me see if there's any improvements to this presentation I can make. You can use the link below, and it would take you to a survey with just a few questions. Here are listed the references that I used throughout my presentation. I do encourage you to check them out, especially if you found any of the studies I mentioned interesting and are wanting to know more about them. And lastly, I want to say thank you for taking the time to listen to this presentation. And I hope you are able to learn a bit more about the importance of professional interpretation services and how we need to use these services more often. Remember, LEP patients are not going anywhere. You will encounter them in the emergency department, in your family practice, during OBGYN visits, and many other settings. So let's be prepared and remember to use a professional interpreter. If you have any questions or comments, please leave them below.